There are key developments this week in the fight against HIV. An advisory panel that works with the FDA has pre-approved an in-home oral HIV test. It's called OraQuick, and if approved by the FDA, this test would be available to consumers over the counter. Dr. Sujatha Reddy is a physician at Premier Care for Women in Atlanta. So, Doctor, good to see you. This is pretty extraordinary. Why is this such an incredible breakthrough that this would get pre-approval? It doesn't have complete red light, or green light from the FDA, but close?
It is. The advisory committee recommended that the FDA approve this test, and why this is exciting is about 20%, or about almost 250,000 people of the 1.2 million people in the U.S. who have HIV don't know they have it. And by not knowing, that's how we think most new cases of HIV are being spread. So being able to get tested in the privacy of your own home is hopefully going to increase testing, and that's awesome.
Wow. And how does it work?
It's a very simple test. It's exactly the same test that's been used in doctors' offices and hospitals since 2002. It's very accurate. And all you do is you take this thing and you swab it on the inside of your upper gum, inside of your lower gum. You place it in this solution, and just like pregnancy tests, which a lot of people read at home, you're going to see 2 lines for positive, 1 line for negative in about 20 minutes. It's very fast, it's very accurate, and very easy.
So you already said that a lot of doctors feel like it's accurate, just like the test that you would take, or blood test, or even saliva test that you take at your doctor's office. However, you know, a lot of folks might be reluctant to take the next step. While they may be reluctant to go into a doctor's office, they can do this at home, but then it is incumbent upon you, if you get a positive test, to take it to the next level. You do have to reach out for assistance.
Definitely. If you get a positive test, there's a 24-hour hotline the company has that you have counselors that can talk to you, but for sure, you need to go to your healthcare provider for a confirmatory test and also for treatment, because one thing is, if you can diagnose this early, your odds of surviving this are much better. So really, it's incumbent upon the person. It's in their best interest to go get treatment. Also, then you can take precautions to decrease the risk of transmitting it to others.
And would it be recommended when you get that kit, you know, if indeed it hits the market, that you do it more than once? Because what if, you know, that initial positive or negative is not right?
You are absolutely correct. And that's a really important point. There's a window that's known there when you get exposed to HIV. So if someone got exposed yesterday, you're correct. Their test might be negative today, but it can be positive within 3 to 6 months. So it's very important, if you think you could be exposed, to repeat the test at timely intervals. The CDC does recommend that adults 13 to 64 get a test at some point, and then there are other high-risk groups that recommend a test on a more regular basis. So really knowing when to get tested is going to be key.
Yeah, and then once you take this test, I mean, counseling, it seems like it really ought to be pretty imperative, because to hear that you did test positive, even if you did this in the comfort of your own home, that's a, you know, tough pill to swallow.
Counseling is going to be key, and the company has a hotline. There are community agencies that have counseling available. So definitely, if you get a positive test result, it's, you know, the thing to do is find out what your next step, which is going to be go see your healthcare provider for a confirmatory test and to get started on treatment early, because that's the key to survival.
Wow. And when do we think this might be on the market or available?
That's a good question. No one knows. The FDA usually takes their advisory committee's advice, so it should get passed, should get approval. The cost is going to be anywhere around $60. We talked to the company and got some information from them, and they're very excited about this, obviously, because they think it is going to help a lot of people. But I did a little homework, too, and you can walk into any lab test place and get a blood draw for about $49. So the test is comparably priced. It's going to be available at retail pharmacies.
It's just the difference is, for some people, they feel a little bit more comfortable knowing they can do it at home, as opposed to going to a doctor's office and sometimes being rather public about what they're about to embark on, huh?
Definitely. In the privacy of your home, the idea is to encourage more people to get tested, because that's going to be how we're going to stop the spread of HIV.
All right, Dr. Sujatha Reddy, thanks so much. Appreciate it. It was good to see you.
You too.